Did you know that over 25% of adults worldwide have fatty liver disease, and most don't even know it? It's often called a silent threat because it develops unnoticed for years until serious damage has already occurred. If left untreated, fatty liver disease can lead to inflammation, scarring, and even liver failure. The good news? Your body gives you warning signs long before things get critical. In this video, we'll break down 8 key symptoms that could indicate fatty liver disease and what you can do to stop it in its tracks. Make sure to watch until the end because recognizing these signs early could save your life. And if you find this information helpful, don't forget to leave a like and subscribe to stay informed about your health. What is fatty liver disease? Fatty liver disease, medically known as hepatic steatosis, occurs when an excessive amount of fat builds up inside liver cells. While it's normal to have a small amount of fat in the liver, when this fat becomes excessive, it can lead to inflammation and potentially severe liver damage. Over time, if left untreated, fatty liver disease can cause scarring, cirrhosis, and even liver failure. There are 2 main types of fatty liver disease: non-alcoholic fatty liver disease, NAFLD. This type is primarily linked to poor dietary choices and an unhealthy lifestyle, including being overweight, sedentary, or having an imbalanced diet high in processed foods and sugars. NAFLD is increasingly common and is now one of the leading causes of liver-related health problems globally. Alcoholic fatty liver disease, AFLD. As the name suggests, this form of fatty liver disease is caused by excessive alcohol consumption. Drinking too much alcohol puts stress on the liver, leading to fat buildup, inflammation, and damage over time. Both types can cause serious health risks if not managed. However, the problem is that fatty liver disease often doesn't show noticeable symptoms early on. In fact, many people may have it without even knowing. Still, your body does send subtle signals. If you can recognize them, you may be able to catch the condition early and take action to protect your liver. Common causes of fatty liver disease. Several factors contribute to the development of fatty liver disease, and many of them are linked to modern dietary habits and lifestyle choices. Overconsumption of omega-6 vegetable oils. Oils like soybean, corn, and canola oils are commonly used in processed foods and cooking. While they are often marketed as healthy, when consumed in excess, they can disrupt the balance of fats in the body and contribute to fat buildup in the liver. High intake of sugary foods and refined carbohydrates. Diets high in sugar, particularly refined sugars found in sweets, sodas, and processed foods, can lead to insulin resistance. This condition forces the liver to store more fat, increasing the risk of fatty liver disease. Excessive alcohol consumption. Drinking large amounts of alcohol regularly stresses the liver and leads to inflammation, fat buildup, and eventually liver damage. High fructose corn syrup in processed foods. Fructose, especially in the form of high fructose corn syrup, found in many sugary beverages and processed snacks, can directly contribute to fat accumulation in the liver. Certain medications and viral infections. Some medications, such as steroids and viral infections like hepatitis, can also play a role in the development of fatty liver disease. The tricky part? Many people with fatty liver disease experience no symptoms until the condition has progressed significantly. That's why it's so important to stay aware of your health and recognize the subtle signs that your liver might be in trouble. Fortunately, if you know what to look for, catching it early could make all the difference in preventing long-term damage. 8 signs of fatty liver disease. Fatty liver disease may not always present obvious symptoms, but your body does send out subtle signals that something might be wrong. Here are 8 common signs that could indicate fatty liver disease and help you take action before it progresses further. 1. Right shoulder pain. If you've been dealing with consistent pain or discomfort in your right shoulder, neck, or under your shoulder blade, it may not just be muscle tension. The liver could be to blame. Why? The liver plays a key role in bile production, which is essential for digesting fats. When the liver becomes clogged with excess fat, bile production is disrupted, causing it to become thick and trapped. This leads to inflammation, and the swelling can put pressure on the phrenic nerve running along your right side, resulting in pain in the upper back, neck, or shoulder. If this pain persists, and you can't link it to any other reason, it might be time to check your liver health. 2. Abdominal fat, also known as a potbelly. An expanding waistline, especially around the abdomen, is one of the most common signs of fatty liver disease. Fat starts to accumulate inside the liver, and as it fills up, the excess fat spills over to the surrounding areas, especially around the belly. This kind of abdominal fat, known as visceral fat, isn't just unsightly, it's also dangerous. It wraps around internal organs and increases the risk of serious health issues, including high blood pressure, heart disease, and type 2 diabetes. If you've noticed a significant change in your waistline, it could be an indication that your liver is struggling. 3. Spider veins. If you've started noticing small web-like veins appearing on your skin, it could be a sign of liver dysfunction. When the liver is overwhelmed and unable to process excess hormones like estrogen, it can weaken blood vessels, which may then appear as spider veins. These tiny red or purple veins often have a branching or radiating pattern and are commonly seen on the face, chest, or legs. While spider veins can be harmless in some cases, their presence in combination with other symptoms of liver problems warrants attention. Quick reminder, if you're finding this helpful, be sure to subscribe for more healthy tips like this. For men, an unusual growth of fatty tissue beneath the nipples is another sign that fatty liver disease may be present. An impaired liver struggles to metabolize estrogen properly, leading to hormonal imbalances. Over time, this can cause gynecomastia, the development of enlarged breast tissue in men. If you're noticing unexplained tenderness or swelling in your chest, it might be worth discussing with your doctor as it could be linked to liver health. If you notice that one of your feet or ankles, particularly the right one, is more swollen than the other, it could be a sign that your liver is having trouble functioning properly. Liver damage affects your body's ability to manage fluid balance, leading to a condition called pitting edema. This causes swelling in the lower extremities, particularly the feet and ankles. If you press on the swollen area and a dent remains after releasing the pressure, it's a clear indicator of fluid retention. This symptom should not be ignored, as it may suggest your liver is no longer processing fluids efficiently. An itchy feeling on the palms of your hands or the soles of your feet could seem minor, but when it's persistent, it could point to a liver issue. When your liver becomes overloaded with fat, it struggles to process bile. As a result, bile can build up in your bloodstream and leak into your skin, triggering an allergic reaction that causes itching. This condition, known as pruritus, is common in liver disease and can cause discomfort and frustration if left untreated. Did you know that an underactive thyroid can sometimes be linked to fatty liver disease? The liver plays a vital role in converting the inactive thyroid hormone, T4, into the active form, T3. If your liver isn't functioning well, this conversion process is impaired, leading to symptoms of hypothyroidism such as fatigue, weight gain, and sluggish metabolism. If you're experiencing these symptoms alongside other signs of fatty liver disease, it might be time to address both issues simultaneously. Feeling drained all the time, even after a good night's sleep, can be a major red flag when it comes to fatty liver disease. When the liver is struggling, it becomes less efficient at absorbing important nutrients, including fat-soluble vitamins like A, D, E, and K. This leads to nutrient deficiencies, which in turn contribute to chronic fatigue and a general feeling of sluggishness. If you find yourself constantly exhausted with no clear explanation, it could be a sign that your liver isn't processing nutrients as it should. Many of these symptoms may be subtle or easy to overlook, but recognizing them early could help you take the necessary steps to prevent more serious liver damage. If you're experiencing any of these symptoms, it's important to consult with a healthcare professional for further evaluation and to discuss potential treatment options. How to reverse fatty liver disease. The liver has an incredible ability to heal and regenerate, but it needs the right support to do so. By making some strategic lifestyle and dietary changes, you can help your liver recover and start reversing fatty liver disease. Here are 6 effective steps to get started. One of the biggest contributors to fatty liver disease is the consumption of inflammatory vegetable oils, such as canola, soybean, and corn oils. These oils are high in omega-6 fatty acids, which can promote inflammation and fat buildup in the liver. To support liver health, ditch these oils and switch to healthier options like coconut oil, extra virgin olive oil, and avocado oil. These oils are more stable when heated and provide beneficial fats that support liver function. Your liver plays a key role in breaking down fats, but when it's compromised by fatty liver disease, it can struggle to process fats effectively. One way to help your liver is by using digestive enzymes. A high-quality enzyme supplement that contains bile, pancreatin, and betaine hydrochloride can support the breakdown of fats and ease the burden on the liver. These enzymes can also help detoxify the liver and improve digestion, allowing your body to absorb essential nutrients more efficiently. One of the most effective ways to reverse fatty liver disease is to reduce your intake of sugar and processed foods. These foods, particularly refined carbohydrates like bread, pasta, and sugary snacks, contribute to insulin resistance and fat buildup in the liver. Instead of processed foods, focus on nutrient-dense options like grass-fed meats, eggs, wild-caught fish, and sulfur-rich vegetables like garlic, onions, and broccoli. These foods support liver detoxification and provide essential nutrients that promote liver health. Milk thistle is one of the most potent natural remedies for supporting liver health. The active compound in milk thistle, silymarin, helps to promote liver detoxification and repair. To support your liver's detoxification processes, consider taking 150 milligrams of milk thistle extract daily. This powerful herb boosts the production of glutathione, the body's master antioxidant, which is crucial for neutralizing toxins and repairing liver damage. Over time, this can help regenerate liver cells and reduce fat accumulation. Intermittent fasting is a highly effective strategy for improving liver health and reversing fatty liver disease. By giving your liver time to rest and repair, you allow it to focus on healing and regeneration. One popular fasting method is fasting for 20 hours a day, consuming all your calories within a 4-hour window. This fasting regimen triggers autophagy, a process where your liver breaks down and recycles damaged cells. Autophagy not only helps cleanse the liver but also promotes overall health and longevity. Start your day with a natural liver cleanse by drinking a combination of apple cider vinegar and lemon water. Mix 1 tablespoon of apple cider vinegar with 2 tablespoons of fresh lemon juice in 500 milliliters of water, and drink it in the morning. This drink helps to boost bile production, which aids in fat breakdown and liver detoxification. Apple cider vinegar also helps balance your body's pH levels and improve digestion, giving your liver the support it needs to function more efficiently. If you recognize multiple symptoms from this list, it's crucial to take action now. The earlier you make changes, the better your chances of preventing serious liver damage. Don't ignore these warning signs. Prioritize your liver health today. If you found this video helpful, don't forget to like, share, and subscribe for more life-saving health tips. If you want to learn more about natural remedies for health, watch this next video.